Ever wondered what goes into drawing blood with precision and care? Phlebotomy might seem straightforward, but there's a lot more to it than meets the eye. Stick around to learn the essentials that every phlebotomist should know. Hi everyone, and welcome back to Phlebotomy Pro Tips, Nurses Edition. If you're new here, I'm Marjorie Lundy, and on this channel, we dive into all things healthcare, sharing tips, techniques, and insights to help you excel in your medical career. Today, we're covering the essentials of phlebotomy, from mastering needle insertion to ensuring patient comfort. Whether you're just starting out or looking to refine your skills, this video is packed with valuable information. Let's jump right in. The importance of vein assessment. Before you even think about picking up a needle, assessing the vein is your first and most important step. Here's why. Palpation. Always use your fingers to palpate the vein. Look for one that's firm and bouncy, which usually indicates a good vein for puncture. Visual inspection. Don't just rely on sight alone. Sometimes, veins that look promising might not be ideal once you feel them. Make sure you're relying on both visual and tactile assessment. Consider the patient's history. If the patient has a history of difficult draws, take that into account. They may have preferred veins that work well for them, so don't hesitate to ask. Proper vein assessment sets the foundation for a successful and smooth blood draw. Perfecting your puncture technique. Let's talk about the actual blood draw. Mastering your technique is crucial for minimizing discomfort and ensuring accuracy. Needle positioning. Always ensure the bevel is facing up, and insert the needle at a 15-30 degree angle. This positioning helps you enter the vein smoothly and reduces the risk of complications. Anchor the vein. Use your non-dominant hand to anchor the vein just below the puncture site. This keeps the vein stable and prevents it from rolling away from the needle. Smooth insertion. Insert the needle smoothly and with confidence. Hesitation can lead to a more painful experience for the patient, so steady your hand and go in with purpose. With these tips, you'll perform needle punctures like a pro, making the experience easier for both you and your patient. Managing blood collection and tube order. Collecting the blood correctly is just as important as finding the vein and inserting the needle. Here's what you need to keep in mind. Correct tube order. Always follow the correct order of draw to prevent cross-contamination between additives in the tubes. Remember, blood culture bottles first, followed by coagulation tubes, then serum, and so on. Monitor flow. Keep an eye on the blood flow into the tube. If the flow stops or slows, you may need to adjust the needle slightly. A steady flow indicates proper needle placement. Fill tubes to the mark. Ensure each tube is filled to the designated mark. Underfilling can compromise test results, while overfilling might cause the sample to clot before it reaches the lab. Proper blood collection techniques are key to accurate lab results and patient safety. Troubleshooting. Common phlebotomy challenges. Even seasoned phlebotomists encounter challenges. Here's how to troubleshoot the most common issues. Missed veins. If you miss the vein on your first attempt, don't panic. Withdraw the needle slightly and adjust your angle, or choose another site. Remember, it's okay to take a moment to reassess. Hematomas. If a hematoma starts to form, remove the needle immediately and apply pressure to the site. A cold compress can help reduce swelling and discomfort for the patient. Slow blood flow. Slow flow could mean the needle is partially in the vein or against the vein wall. Gently adjust the needle's position and reassess the flow. Knowing how to handle these challenges quickly and efficiently will keep the process smooth and reduce patient discomfort. Finalizing the procedure and patient aftercare. You've drawn the blood. Now let's talk about finishing up and ensuring the patient leaves in good shape. Needle removal. Gently remove the needle in a swift motion, and immediately apply pressure to the site. Use gauze and have the patient apply pressure for at least 30 seconds to a minute. Bandaging. Once the bleeding has stopped, apply a bandage or adhesive strip to protect the site. Remind the patient to keep the bandage on for at least a few hours and to avoid strenuous activity with that arm. Aftercare instructions. Provide clear aftercare instructions, such as watching for signs of infection or excessive bruising. Encourage them to stay hydrated, especially if they're donating blood or had multiple tubes drawn. Ending the procedure with proper aftercare ensures the patient's comfort and reduces the risk of complications. Patient communication and comfort. The technical aspects of phlebotomy are vital, but so is how you interact with your patients. Effective communication can make a world of difference. Clear explanations before you begin. Explain the procedure to your patient. Let them know what to expect, including any sensations they might feel, like a pinch or pressure. This helps reduce anxiety and builds trust. Empathy and reassurance. Many patients may feel nervous about blood draws, especially if they've had bad experiences in the past. Show empathy by listening to their concerns and offering reassurance. Sometimes, a few kind words can make the process much smoother. Distraction techniques. For particularly anxious patients, distraction can be key. Engage them in light conversation, ask about their day, or encourage them to focus on their breathing. These small distractions can significantly reduce their stress levels. By prioritizing patient communication and comfort, you'll create a more positive experience, which can lead to better cooperation and repeat visits. Handling special cases and pediatric patients. Special cases, like pediatric or elderly patients, require extra care and specific techniques. Here's how to manage these scenarios. Pediatric patients. For children, phlebotomy can be especially daunting. Use smaller needles, such as a 23 gauge, and consider using a butterfly needle for more delicate veins. It's also helpful to have a parent or guardian present for comfort. Keep the atmosphere light and friendly, and use distractions like toys or cartoons when possible. Elderly patients. Older patients often have fragile veins that are more prone to collapsing. Use a gentle touch, and consider using a smaller needle if necessary. Be mindful of skin integrity when applying and removing adhesive bandages. Patients with difficult veins. For patients with difficult or hard-to-find veins, try techniques like warming the area, using a blood pressure cuff instead of a tourniquet, or having the patient hold a hot pack. These methods can help dilate the veins and make them more accessible. Adapting your approach based on the patient's needs is crucial for successful and compassionate care. Infection control and safety protocols. Maintaining a sterile environment and following safety protocols are non-negotiable in phlebotomy. Here's a refresher on key practices. Hand hygiene. Always wash your hands thoroughly before and after each procedure. Use hand sanitizer if soap and water aren't readily available, but remember that proper hand washing is always the gold standard. Personal protective equipment, PPE. Wear gloves for every blood draw, and change them between patients. Depending on your facility's protocols, you might also need to wear a mask, gown, or face shield. Needle safety. Never recap needles after use. Immediately dispose of them in a designated sharps container to prevent needle stick injuries. Always be mindful of where your needle is during the procedure to avoid accidental contact. Strict adherence to infection control and safety protocols protects both you and your patients. Documentation and lab communication. Accurate documentation and clear communication with the lab are essential parts of the phlebotomy process. Here's what to keep in mind. Labeling samples. Label each tube immediately after drawing, and do so in front of the patient to confirm their identity. Include essential details such as the patient's name, date of birth, the date and time of collection, and your initials. Requisition forms. Ensure that all requisition forms are complete and accurate. Double-check that the test orders match the tubes you've drawn and that all information is legible. Communicating special instructions. If there are any special instructions for the lab, such as a need for immediate processing or specific storage conditions, make sure these are clearly communicated. Use the designated area on the requisition form or a separate note if necessary. Proper documentation and communication help ensure that lab results are accurate and returned promptly. Continuous improvement and professional development. Phlebotomy is a skill that can always be refined. Here's how to keep improving. Seek feedback regularly. Ask for feedback from your peers, supervisors, and even your patients. Constructive criticism is one of the best ways to identify areas for improvement. Stay informed, keep up with the latest developments in phlebotomy techniques, technology, and best practices. Consider attending workshops, webinars, and conferences to stay current. Practice, practice, practice. The more you practice, the better you'll become. Take every opportunity to refine your technique, whether it's during your regular shifts or through simulated practice sessions. Commitment to continuous improvement ensures that you remain an effective and knowledgeable phlebotomist throughout your career. Building patient trust and rapport. Building trust with your patients is a key component of phlebotomy. A strong rapport can make the blood draw process more comfortable and less stressful for everyone involved. Establish eye contact. Start by making eye contact and offering a warm greeting. This small gesture shows that you're approachable and attentive. Active listening. Take the time to listen to your patient's concerns or fears. If they mention a bad experience in the past, acknowledge it and reassure them that you'll do everything to make this experience better. Personalized care. Treat each patient as an individual. Remember their preferences, such as which arm they prefer for blood draws, and make adjustments based on their comfort level. Personal touches like these can go a long way in building trust. When patients trust you, they're more likely to remain calm and cooperative, which makes your job easier and the experience better for them. Time management and efficiency. Being efficient without rushing is a skill that every phlebotomist should master. Here's how to manage your time effectively. Preparation. Before bringing a patient in, ensure that all your supplies are ready and within reach. This includes having the right needles, tubes, labels, and other equipment at hand. Streamlining processes. Develop a consistent routine for each blood draw. By following the same steps each time, you'll become faster and more efficient without sacrificing accuracy or patient care. Multitasking. While you're waiting for a tube to fill, you can use that time to prepare the next tube, label the already collected ones, or engage in light conversation with your patient. Efficient use of time can reduce the overall duration of the procedure. Efficient time management not only improves workflow but also minimizes the time your patients spend in the chair, which they'll appreciate. Dealing with difficult situations. Sometimes, you'll encounter difficult situations that require patience and skill to navigate. Here's how to handle them. Anxious or incooperative patients. For patients who are anxious or incooperative, maintain a calm and patient demeanor. Use gentle persuasion and clear explanations to guide them through the process. If necessary, involve a colleague or supervisor for assistance. Vein collapsing. If a vein collapses during the draw, don't panic. Gently remove the needle, apply pressure to the site, and choose an alternate site for a second attempt. Remember, it's better to take a moment to reassess than to cause discomfort or injury. Patient reactions. In the rare case of a patient experiencing a severe reaction, such as fainting or an allergic response, you need to act quickly. Follow your facility's emergency protocols, ensure the patient's safety, and seek medical assistance immediately. Handling difficult situations with grace and professionalism is a hallmark of a skilled phlebotomist. Enhancing your workspace plays a big role in your efficiency and comfort as a phlebotomist. Here's how to optimize it. Organization. Keep your workspace clean and organized. Arrange your supplies in a way that makes them easy to access quickly. A well-organized space reduces stress and helps you maintain focus. Ergonomics. Ensure that your workspace is ergonomically designed to prevent strain or injury. This includes having an adjustable chair, proper lighting, and ensuring that supplies are at a comfortable reach. Patient comfort. Make sure that the patient's chair is comfortable and positioned correctly. Providing a comfortable environment for your patients can help ease their anxiety and make the blood draw process smoother. An optimized workspace enhances both your efficiency and the patient's experience. Reflecting on your practice. Finally, it's important to regularly reflect on your practice as a phlebotomist. Continuous self-assessment helps you grow and improve. Daily reflection. At the end of each day, take a few minutes to reflect on what went well and what could have been better. This simple practice can provide valuable insights into your strengths and areas for improvement. Seek peer feedback. Don't hesitate to ask your colleagues for feedback on your technique or patient interactions. Constructive criticism from peers can help you identify blind spots and make necessary adjustments. Celebrate successes. Take time to celebrate your successes, no matter how small. Whether it's a particularly challenging draw that you nailed or positive feedback from a patient, acknowledging your achievements keeps you motivated and focused on continued excellence. Regular reflection and feedback help you maintain high standards in your phlebotomy practice. If you found these tips helpful, make sure to hit the like button, share this video with your colleagues, and subscribe to Phlebotomy Pro Tips, Nurses Edition for more healthcare insights. And don't forget to leave your questions or comments below. I'd love to hear your thoughts and experiences. Let's recap what we've covered today. We talked about the basics of phlebotomy, mastering needle insertion, ensuring patient comfort, handling common challenges, and the importance of continuing education. Thanks so much for watching, and I truly appreciate your support. Stay tuned for more videos to help you excel in your healthcare career. Until next time, take care and keep practicing those phlebotomy skills.